Okay, good morning, everybody. Thanks for your patience. I know we're starting a couple minutes later than usual. My name is Erin Haldine. I'm the CFFS policy lead here in the Disability Services Division, and thanks for joining us for the lead agency CFFS office hours for the month of September. Today we're going to do give you a quick update on where we're at with the consultation services RFP. We'll give a reminder about the 6893W, talk a little bit about reassessments. We received a couple questions regarding what CFFS looks like for people who are on a waiver or AC. So we'll review that, and then we'll talk about the topic of the month, which is going to be mid-year changes to a service delivery plan. And then we'll open it up to answer any questions that you guys might have. So if we can, remember to, if you're putting anything in the Q&A or the chat, just make sure you're not writing any specific names of organizations or people. And then if possible, just ask questions on the slide that we're presenting so we can just keep track of the questions that are coming in and answer them as we're looking at each slide. And then if we get to a topic that we didn't cover, then go ahead and ask that during the open Q&A at the end. That'll just help us stay a little more organized. So our first slide is on the consultation services RFP. So I think all of you know that we had opened the RFP to add additional consultation service providers. We recognize that that is at this point really where the bottleneck is in getting people transitioned over from CFFS, or I'm sorry, from PCA and CSG to CFFS. There just aren't enough providers, or the wait lists are too long. And so we do want to add more consultation service providers. So we opened the RFP and proposals were due by August 29th. We're going to evaluate all of the proposals that were submitted to us through the month of September, and then notify people or notify organizations that are successful by October 31st. So that is the timeline that we had originally published. We did receive 132 proposals. So that is a lot more than we anticipated. So what we're doing is we're breaking those submitted proposals into kind of different groups or chunks of proposals that we're reviewing at a time to try to get some through the process faster. So it's there's no rhyme or reason to which proposals we're looking at first, but basically those, we've already reviewed 12 proposals and we're continuing to go through different batches or groups. So there might be some providers who are notified before October 31st that they have successfully submitted a proposal and have been chosen. There might be a few providers who are notified a little later than that, but this is the timeline that we are trying to work towards. And like I said, we received a lot more than we anticipated, which is great. Hopefully we can get new providers up and running as soon as possible. It is going to take some time to get all of those new providers or the successful providers enrolled as well as trained. And so likely they will not be up and running until 2026. So keep that in mind as you're thinking of these new consultation service providers being added. And then we're required to now keep the RFP open. And so we have actually received, I don't know, probably 10 or 15 additional proposals that were submitted after the due date. And I anticipate that we'll continue to receive proposals going forward. And so we don't have a date yet of when those are going to be reviewed, but know that we are keeping it open. And then once we have, more proposals submitted, then we'll continue to review those later in 2026. So there might be even more providers later on.
So Erin, it's Janine. I just wanted to say the reason why we're required to keep this open is per CMS, for us to limit, we would have to ask for an authority that limits choice. And so we are required to keep this open and add consultation service providers as they apply and are eligible.
Thank you. Okay, we were asked to review the 6893W. We've gotten a couple questions recently and just want to make sure that everyone is on the same page. So if you're listening today, if you can please bring this back to the others within your lead agency who are working on CFSS, just to make sure everybody understands that the 6893W is required to accompany all service delivery plans. So that is the plan, someone's initial plan at the beginning of the year, including all the revisions that may occur throughout the service delivery plan year. And that 6893W is not just if there's changes or if the approval looks different than what was on the plan, or the dates, the dollar amounts, or the units. It's a requirement for all 6893W, or I'm sorry, for all service delivery plans. And a reminder that the reason this was put into place is because consultation service providers were developing the service delivery plans, and the date of approval didn't always match the date that was listed on the service delivery plan because consultation providers didn't know when the plan was going to be approved, right? So they were developing those plans with a person, and then they were submitting them to the lead agency for approval. And sometimes that process was very quick, and sometimes those approvals were delayed because they needed to go back and forth with the consultation provider or the person to revise the plan before it got approved. And so units needed to be adjusted, and the dates needed to be adjusted on the plan. So rather than having it continuously go back and forth with the consultation provider, and we heard from all of you that you did not want to change the dates and the units on the service delivery plan, what we put into place was the 6893W. And the W was created as an addendum to the service delivery plan. And that is to give that final approval of these are the dates that services are approved, and these are the number of units or dollars that are available for each of the different service lines. Okay, so this isn't a new process. We started this back in January of 2025, but we're just now getting some emails saying they want consultation to revise the dates on the plan or change the units. And we are not going to do that. Instead, we're going to continue to move forward with using the 6893W. Okay. So the document again is used to enter in the correct CFFS start date based on the plan approval, as well as the total dollars for each service line. And then lead agencies need to ensure that they're signing the 6893W and uploading that into Min Choices. The current 6893P, or the service delivery plan, no longer has a signature for the case manager or the lead agency. Instead, that signature is on the 6893W. Okay, so make sure that that's getting completed, signed, and uploaded into Min Choices. And then you're sending a copy of the W as well as the plan to the person. Okay. If you are from an MCO, you're not required to use the 6893W. Your MCO may have created its own documentation form for you to use, or you can use the W if you'd like to. Okay, and again, actually the signature page on the plan has actually been removed. So just make sure you're signing that 6893W.
Erin?
Yep.
There are a couple of questions in the chat about the W. And so one of them is for a waiver client who wants extended CFFS budget model. Does this go on the plan and on the W, or just on the waiver support plan? The answer to that is just on the waiver support plan. The documents we're talking about, the plan and the W addendum, are only for the state plan benefit. So anything that's extended or waiver services would go on then the waiver support plan and not on these documents. We're only looking at the state plan benefit for these documents. Min Choices support plan, yeah.
Thank you. And then I see a question asking if the W is going to be changed to allow the correct codes, such as T1019. I'm thinking you're meaning that the modifiers are added to it. I know the billing codes are currently on the W. Why don't I open up the 6893W in case somebody is not familiar with the document. And then I can just show it to everybody. Can you guys see this? Is that what I have pulled up?
Yes,
Okay.
it's the plan.
So this
Oh,
is
to the
actually,
plan. No,
okay. Yep,
sorry.
it is
Yep, you're
confusing,
right.
and we get this question a lot. So this is the 6893W. I know it's probably small on your screen, but it says up here in the upper right-hand corner. So this is the addendum to the service delivery plan, and that's why the 6893P is listed here, because that's the form number for the service delivery plan. So I think the question the person is asking, I'll just do an agency model as an example. Let's just say someone is available for eligible for 1,000 units. Just say no. And then I think what you must be meaning here that you are looking for the U9 to be added, since this is the agency model as far as the MMIS code, and that if it were the budget model, you're asking that it be the UB be added in here. I don't think at this time we have intentions of adding all of the different modifiers, but it is something that I can bring back to our team and talk about for a possible future revision. Okay.
So there's a question in the chat about confirming what I thought I just heard. The W is never used for people on a waiver. That is not true. The W is only used for the state plan benefit, regardless if the person is only state plan or waiver. These documents are about the state plan benefit, which people can get on a waiver as well. So anytime someone has a state plan benefit CFFS, you would be using these forms in addition to whatever you might be using for the waiver side.
Right. Yep. So I'll just kind of reiterate what Janine said, maybe in a different way, that the 6893W is required for anybody who is using CFFS. Where Janine was saying the extended CFFS would not be put on the 6893W. So that may have been where the confusion came from. Okay. Okay, so we received a couple questions or requests to review the reassessments. And so I have a couple slides that we've reviewed before, and then we can just talk a little bit more about it or answer questions as we're going through it. So I have two different slides on reassessments. So first is just a review of the reassessments during the extension period. So as you all probably know by now, everyone needs to make that transition to CFFS by September 30th of 2026. With the exception for the people on the alternative care program, they need to transition by March 31st of 2026. Okay, so this timeline here is for everybody except for AC. So anybody who has a reassessment occurring between October 1st and March 30th, if a person, if they have not yet completed that transition to CFFS by their next assessment, the lead agency must authorize 6 months of PCA or CSG, plus 6 units of consultation services, while the person continues to work on transitioning over to CFFS. Okay. And then, of course, if the person if they still don't make the transition and they need an additional 6 months, they could do it within this first time frame, right? So that would happen before March 30th. Then for anybody who has their reassessment occurring between April 1st of 2026 and September 30th of 2026, and they haven't made the transition to CFFS yet, the lead agency is going to authorize PCA or CSG only through September 30th of 2026. So for some people, that will not be a full 6 months, right? If someone has their reassessment in, or they're due to renew in August of 2026, they'll just have 2 months of CSG or PCA. They'll have August and September, and then they'll need to transition to CFFS on October 1st. Okay, so you're gonna again, for this one, lead agency is going to authorize services only through September 30th of 2026, plus 6 units of consultation while the person works on transitioning. Okay. And then in addition, regarding reassessments, so CFFS provider agencies and FMS providers are required to submit the 6893B, or the referral for reassessment, to the lead agency 60 days prior to the end of their service agreement. Okay. Now we know that this is happening, and we are aware, we've been told by lots of different parties, whether it be providers or people or lead agencies, that they're worried about a gap in services that may happen because the provider submits the referral 60 days in advance, and then the lead agency needs to reach out to the person and schedule that reassessment. We know sometimes that's delayed for various reasons. It might be the lead agency is delayed, or it could be that the person isn't as responsive in getting that reassessment done. And then that's leaving a very short period of time for consultation service providers to develop the plan before the end of that 60-day period. And we've received a lot of feedback from, again, lead agencies and consultation providers that they are behind, and they may not be able to schedule or be able to create that service delivery plan for the person because of their delay as well. And so we recognize that this isn't a perfect process. We're aware of the issues, and we're having some internal discussions on ways to solve those problems to avoid a gap in services for people. Okay, so as soon as we have a solution available for everybody, we will inform you. We'll announce it at office hours. We will send out an e-list with a solution. But right now, we're just still having some internal discussions about what to do, as we know this is an issue. I guess I wanted to acknowledge that to everybody, that we know that it's currently a problem. Okay. So the second bullet on here is simply that if a person hasn't yet selected a CFFS provider or an FMS provider and they're due for their reassessment, there is not a provider then who would be sending you that 6893B. And so the lead agency needs to still complete the reassessment, and they may need to do that without the referral. So hopefully you have some sort of tracking mechanism within your lead agency, so you know that that is coming up. And then we've talked to consultation service providers a couple different times and encouraged them to begin working on a draft renewal plan with the person while they're waiting for the assessment results. So we've asked consultation to also track when service agreements are ending, and to be in contact with the person or start working with the person on a draft renewal plan. So copying over what they can from the previous plan, or having a conversation with the person on the phone of maybe what are their interests for this year, et cetera, as they're waiting for those assessment results, so that when the reassessment occurs, they can go into min choices and hopefully be able to finalize that plan really quickly and submit it to the lead agency for approval. Okay. So I'm going to pause there and just see if there's any questions in the chat about this process. So I see a question saying, I have a couple of people who transitioned to CFFS and the consultation provider is no longer providing services. What happens if they can't find a new provider? So there was one provider that stopped PPL, public partnerships. They stopped providing services at the end of June. And my understanding is that they sent a notice out to all their individuals that they were providing service to, and those individuals were to contact a new consultation service provider. And they needed to do that in order to continue receiving services. So if you have people who have not chosen a consultation service provider, I don't know, Janine, should they email us? I mean, they have to have a consultation services line on the service agreement.
That's correct.
Um,
Yeah, I think you would have to let us know. We do have some other staff that are helping to do some reach outs. And so there may be a possibility that we could have that staff do some follow up with the person in finding another consultation provider.
there's a question that asked if I can explain the second bullet on the screen again. So it correlates to the first bullet, but the requirement to send the referral for reassessment, or that 6893B, to the lead agency, it is the responsibility of the provider agency or the FMS provider to send that to you. However, if somebody has been assessed for CFFS, but they haven't chosen a provider agency or an FMS provider yet, there would be no provider to send you that form. Right? And so we recognize that there may be a gap, that you may not be getting the form from anybody because there isn't a provider to send it to you, because no provider has been chosen by the person. Right? So what we're asking you to do is to keep track of when those reassessments are due, and you might have to complete that reassessment without waiting for the referral.
So I will just add, Erin, that our RRSs have and the hub have shared some information with us where some people have been expecting to have like a case manager assigned or something like that, and we're not sure why they are thinking that, because they're not on a waiver, for instance. But there are some people that didn't know that they had to reach out to get a consultation provider because they were waiting for the lead agency to do something. So we're just trying to cover all our bases. The other thing to know is that the 60-day reminder letters that are automatically generated in MMIS have been going out to consultation providers. So they've been getting some notice, and they're not required to do the referral. Consultation is not required to do a referral for a reassessment, but in some cases, they will have a conversation with the person and help that referral get to the lead agency, but it is not their responsibility.
There's a couple different questions, so I'm just going to combine them all into one answer, but there's a couple questions regarding what's the timeline that we think will announce a way to avoid a gap in service, and then just people asking if I can reiterate what that particular comment was. So I'll try to say it the same as I did last time. So DHS is aware that even though a provider may submit the referral to you for a reassessment, that sometimes there is a delay and a person is not getting their reassessment, or they're not getting their service delivery plan developed within that 60-day time frame. Okay, so we're having internal discussions here about what we can do to avoid a gap in service for people. If they've had their reassessment, but maybe there isn't a consultation service provider who has the capacity to develop that service delivery plan with the person, we don't want a person to go without services. So we are having internal discussions here on how to handle that issue, and then we'll notify everybody as soon as we can. So I don't have a specific date that I can provide you on when that notification is going to happen. Know that it's something that we're taking seriously and trying to move as quickly as possible. So we'll let you know as soon as we can. I don't know, Janine, do you have any more to say about that?
I do not.
Okay. I'm just pausing for a second to read through the Q&A to see if there's anything else about this topic. So there's a question about what do they do if the assessment's been completed, but the plan hasn't been submitted. can they authorize CFFS without a plan? So no, the service delivery plan needs to be completed and approved before a person can continue to receive CFFS. So that's really what we're talking about with this gap in service, is we're trying to figure out that solution. Okay. I've seen a couple comments from various counties saying that they are not tracking when a reassessment is due, and they're just asking or requiring people to contact them if they need a reassessment. So I'm just reading what's in the Q&A. I'm not sure if everybody can see it or if just we can, but that's being put out there. So I want to, I'm just going to reiterate, and it's on the screen here so you can see it. A lot of people in the chat seem to be writing that the consultation service provider is supposed to submit the referral, and it's not. It's coming from the provider agency and the FMS provider. So consultation does not submit the 6893B to you. That's coming from the person's provider. So if they've chosen the agency model, that comes from the CFFS provider agency. If they've chosen the budget model, it would come from the FMS provider. There's a question asking, what do we tell clients if we don't have a service delivery plan? I think you need to make sure that, ask them if they've completed a plan. And then if they have, the consultation service provider needs to submit it or put it into MinChoices, upload it into MinChoices so you guys can see it. So they should go back to their consultation provider and make sure it's in MinChoices. Okay, and then just a lot of people making comments about their concern about the gap in service, which we understand that, and we are too, and that's really why I wanted to bring that to your attention, so you guys knew that is something we were aware of and trying to work on. Okay, so hopefully we'll have some more information for you soon. Okay, I'm going to go on to the next couple of slides. We received a question from somebody. We received a question or comment from somebody who asked us if we could just give an overall general review of CFS services when a person is on a waiver or alternative care. And so I have a few slides regarding this topic. So I'll go through all those slides and then I'll pause for questions about waiver. So people can use CFFS if they're on a waiver or alternative care. People will receive an assessment that determines they're eligible for both services, so both CFFS and waiver AC. It's important to understand that the services cannot duplicate each other. CFFS services are part of the AC or elderly waiver case mix budget cap. And that goods and services, while goods and services are allowed under CFFS, they are not covered for people on the alternative care program. Okay, so a person cannot receive CFFS if they're using one of the following waiver or AC services. Okay, so anybody who's using adult foster care, community residential services or CRS, crisis respite, or family residential services cannot also receive CFSS. The only exception to that is for a person if they use family residential services not paid for by a waiver or AC. So there are some services that can be used in combination with CFSS. So a person can use CFSS and the following waiver AC services if the tasks performed by the workers are not duplicative. Okay, so someone can use adult day services, CDCS, customized living, day support, homemaker with assistance with ADLs, individualized community living supports, individualized home supports, integrated community supports, night supervision, pre-vocational services, and respite. So with this, it's important for the case manager or the care coordinator to look specifically at the duplication of services. Okay, and you want to make sure that they are not duplicating each other. A person cannot receive the same service from the same worker and the waiver provider. I'm sorry, let me say that again. A person cannot receive the same service from a CFSS worker and a waiver provider at the same time. Okay. But a person can receive similar supports from both providers at different times. So for an example with that would be a person can receive help with bathing from their individualized community living supports provider on one day, like on a Monday, and then their CFSS worker on Tuesday or a different day of the week, right? So they can receive a similar service, but not at the same time. So for AC and EW specifically, if a person's on AC or EW and not using CDCS, their case mix budget cap includes personal care, worker training and development, goods and services for people only on EW, since that's not allowed under AC, and their FMS fee. The case mix budget cap does not include consultation services. Again, this is for people not using CDCS. Now, if someone is using CFSS and CDCS, the funds to pay for all the CFSS services come out of the person's overall CDCS budget. And that's including the cost of consultation services. The person must use a consultation service provider and select either the agency or the budget model. So the reason that's important is obviously CDCS is always a budget model, right? But if someone is using CFFS, they can still use the agency model, but all of that comes out of their overall CDCS budget. Okay, and if the person selects the budget model, then they have to use the same FMS provider for both CFSS and CDCS. Okay, and this is my last slide on this particular topic, but this is regarding goods and services. So a person who needs a good or a service that is covered by both their waiver and CFSS, they can choose to pay for it either way, either through their waiver dollars or CFSS. So a person can really use their full CFSS benefit for personal care and then use their waiver for the goods and services or PERS if they would choose to, or if they would like to. The person may use either the CFSS funds or the waiver funds. Okay, so that's kind of a duplicated sentence, but to purchase goods or services. And then just another reminder that people on the AC program cannot use CFSS to purchase goods and services. Okay, so I'm going to pause there and see if there's any questions regarding waiver and CFSS. Not seeing anything yet. Okay, so it's
Erin, I'm sorry, this is Dawn. Just real quick, I just wanted to know, just for clarification on the bottom of that slide, people on the AC program can't use CFSS to purchase goods. I mean, of course, they're using the personal care service. So just want to make sure that we're clear on that. It's really more about the goods or the items or the PERS that they would be provide or requesting, but they can use, of course, CFSS for the actual services.
correct. Yep. So they can use CFSS for personal care,
Yep.
but goods
Just
are,
yeah, it just gets a little confusing there. So I just wanted to point that out. Thank you.
Don. Yeah, thank you, Don. So someone asked a question saying, for goods and services, should the waiver be used first? It doesn't have to be. I know typically the Janine, please step in or correct me if I'm wrong here, but typically the waiver is the payer of last resort. But that when CFFS, the person can use all of their CFFS benefit to use personal care or for personal care. So the person may need to use their waiver dollars for goods, but they don't have to. They can certainly use their CFFS dollars to purchase goods. But it's really up to the person.
Yeah, and this is Janine, and we're talking with federal relations about getting some kind of better wording around that, which we've been trying to do for a while now. But if concretely, if the person needs CFSS for their personal care benefit, they can use all of their CFSS benefit for personal cares, and then any other goods or services that are coverable under the waiver can be covered under the waiver. Since CFSS is a state plan service, which is usually looked at as first payer and waiver as last payer.
So there's a question in the chat about if a person is using CFSS budget model and CFSS budget model extended on a waiver, are there two separate FMS fees calculated for the waiver and another for CFSS, or should the FMS only receive payment from one FMS fee line? Janine, do you know how that looks for extended?
I don't.
We have a page in the CFSS manual that lays out authorization.
Okay, thank you. If you wrote this, maybe you could send that to us in an email, and then we can respond in an email with a link to that manual page. Thank you. Okay, I think I'm going to go to the next slide here, and we'll talk about our topic of the month, and then any other questions we can come back to at the end. I'm just kind of keeping an eye on the chat as I'm talking here, so sorry if I sound distracted. Okay, so I'll move forward here with the topic of the month. The topic of the month is going to be revisions to the service delivery plan. So we recently published, I think it came out last week in an e-list, if I'm remembering correctly, but we have gotten a lot of questions from providers, from people, from lead agencies about what to do when someone wants to change their plan mid-year and how to handle each of the different scenarios that can occur. So what we've done is we've created this grid that I'm going to pull up. It's within our policy manual. So if you're looking for this on its own, it is down here. So this is the policy manual table of contents. It is down on the bottom under resources, and it's labeled, we're going to look at this one, the mid-year changes for county and tribal nations. We do have a mid-year changes for MCOs, but just for today's presentation, I'm just going to take a look at the county and tribal nation. The MCO one is very similar. Okay. So this is just a guide to help you and to help providers understand what the steps are for each of the different types of revisions that can occur during the middle of the year. We did our best to think through all of the revisions that we typically see. There may be some that are missing. So if you're noticing as you're plugging along that you're continually seeing a change happen that maybe isn't on this grid, just send us an email. We don't need to know all the specifics, but because I think we did a pretty good job talking or looking at each of them, but you might run into something that maybe we hadn't thought of yet. So the way this grid is set up is we have different columns. So the first column is just describing the change that might happen. Then a column about if the consultation service provider is responsible for revising the service delivery plan. Does the county or tribal nation need to approve the change? Does the county or tribal nation need to complete that addendum or the 6893W? Does the county or tribal nation need to revise the service agreement? What action does the provider need to take? And then what resources are available to learn more about the process? Okay, so I'm going to start by just reviewing this first one. So this first change that we're talking about is moving units and dollars between personal care, goods and services, PERS, or the FMS fee. Okay, so if one of these totals change and you need to move money between those two different lines, what do you need to do? Okay, so first, the consultation needs to revise the service delivery plan. Okay. Second, the county tribal nation needs to approve that revised plan. Okay, so the person should be notifying consultation. Consultation provider will revise the plan and upload that into MinChoices. They should notify you that a revision has been put into MinChoices so you can go in and approve that revision. And then you need to complete the new 6893W. Okay, and then you'll be sending that 6893W and the plan to the person so they know that that change has occurred. And then you'll want to go in and revise the service agreement. If for some reason you're unable to revise the service agreement, then you can submit the change request form or the 6893I to DHS. Okay, and then the provider agency needs to discuss with the person how they're going to use their updated number of units. And again, that's just for the agency model. Okay, so and the reason we have that in there is if somebody would like to use some of their personal care units because they want to add a good or they want to add PERS, or maybe their FMS fee increased for some reason, right? They're going to have to reduce the number of personal care units or hours that are available. And so the provider agency should be talking with the person to determine how they're going to use those hours going forward. Okay, and then this is just a resource to refer to. Okay. So I'm not going to go through every single example, but I will show you what's on here. And then I'm going to ask if you guys have some examples that you'd like me to review or you'd like us to review together. So I'll just show you what we have on here for each change. So another idea was changing the cost of a specific good or service, PERS or FMS fee. Changing a specific good or service. So maybe the dollar doesn't change, but the actual good itself is changing. Changing a specific worker training and development class. Adding more consultation services sessions. Adding more worker training and development. adding a failed background study for someone who's on the budget model. Changing models. So a person may want to switch from agency to budget or budget to agency model. Changing or adding an FMS provider. Changing or adding a CFFS provider agency. Changing or adding a consultation service provider. Changing a PERS provider. Changing the participant representative. Changing a county of financial responsibility, or changing the county of residence. Okay, so I want to point out that this first grid here that I've been showing you is, sorry, I know it's hard to watch someone scroll. This is specifically for changes for people that are not on a waiver, or that people who have a type B service agreement. And I'm going to scroll down quickly here. And we have a grid underneath all of that with all of the same categories, but it specifically changes for people who are on a waiver or alternative care. So just make sure that you're looking at the correct grid, because the process may change slightly. But all of the same types of changes are available under both grids. Okay, and then like I said, we have a different page that is the same information, but for MCOs. Okay, so I'm happy to review any scenarios if people want to put in the chat if there's specific ones that you'd like us to go over today. I'm happy to do that. So I'm just going to pause for a second and see if give you an opportunity to put something in the chat if maybe you've dealt with a specific scenario and you're wondering how to make that change or what your role is in that process. Oh, can I share the website? Yep, I'll go ahead and put a link in the chat. I hope this goes to. Oh, whoops, hold on just a second. I have to find that comment. So, okay, hopefully everyone can see that. Otherwise, it's in the CFFS policy manual. I'll show you guys again. If you go to our CFFS policy manual, just the homepage, if you don't have that link, you could just Google it. My computer is being kind of slow. But under the bottom here of the table of contents is the resources tab, and you can just click on that little chevron or arrow off to the side, and it's here, mid changes for county. Oh, here we go. Here we go. Resources, mid-year changes for counties and tribal nations. Okay, and then it brings you to the page.
Hey, Erin, there's a couple of questions in chat. One of them, if we have straight CFFS case transferring to another county, do we need to close or prorate the service agreement prior to transferring? So this has been a big topic. And so for state plan services like CFFS or PCA, we don't have the same rules as waivers. We don't, for a type B agreement, we don't care what county the person lives in, who did the assessment, all of those kinds of things. So there isn't a process for when someone moves from one county to another. We get questions about it. We're just asking for the counties to work together on what makes sense. A lot of times in our minds, it seems like the county that actually did the assessment might be the best person to make any changes mid-year in the service delivery plan. But sometimes that may not be true. I don't know what exact changes are being made when somebody moves from one place to another. Maybe it's having to find a new service provider or whatever it might be. But we don't have like COR, CFR kinds of things that go on in state plan. Anybody from whatever county or lead agency can add a type B service agreement regardless of where the person is living. So there is no closing service agreements. There is no prorating or anything like that. Just so everybody's clear about The state plan type B agreements we do not require any of those jumping through hoops like waivers do, especially on the disability side. I know less about aging, but no, there is no changing anything that is required if somebody moves from your county to another county.
Thanks, Janine. And thanks for asking that question. So I did pull up here on the grid what we have for those particular questions. Again, this top portion of the page is just for state plan services. You can see we have not applicable or NA in all of those different categories. So consultation, revising the plan, lead agency approving the plan, case manager action, provider action, right? Nothing needs to be done. If someone changes the county of residence, we just have updating the plan, but there's no approval or anything that's needed. Okay. So again, that's just for state plan. If I scroll down, and again, sorry, I know it's hard to watch people scroll, but this next grid is for people on a waiver, remember, and I'll go down to the very bottom. And then we have some more instructions for people who are on a waiver, because that is slightly different. Okay, so this is a good resource to kind of answer those types of questions. I see a question asking, and this is looks like it's from an MCO perspective, or but this would really apply probably to both MCOs and non. But so just to make it clear, within the grid, I'm going to buzz back up to the top here. The consultation service provider for some of the changes may need to adjust the service delivery plan. It's not required on every type of revision, but on some revisions it is. If they revise that service delivery plan, then that next column you're going to want to make sure you read is, does the county or tribal nation, or on our MCO grid, does the MCO need to approve that change? So you'll receive a copy of that revised service delivery plan, and that's how you're going to be notified that the change is being requested. So remember that a person may be requesting a change. They'll work with their consultation provider to revise the plan, but you still have to approve that, right? So in most scenarios, not every single one, there's some where the answer is no, that it doesn't need to be approved. But so you'll be notified when that change happens, and you'll know what to do. So whatever your next steps are, there might be some documentation that you need to send to the person. It looks like in this person's question says that they need to update the support plan and min choices and send a revised letter for a signature. That's coming from an MCO perspective. You'll be notified because the consultation provider will be giving you a revised plan that will indicate what's been changed. Okay, and that way you'll know if you approve it, then you'll have to take your next steps.
Aaron, there is somebody with their hand up, Timothy Peterson.
Oh, okay. Does anyone have the ability to unmute the person? Thanks, Mike. I can't see that on my end, so feel free to interrupt if someone is raising their hand.
And now I can't see it either. It's possibly you retracted it.
Oh, okay. If someone would like to be unmuted, just raise your hand and then we can figure that out on our end if you have a question you'd rather ask. Okay, I see a lot of just comments in here that sometimes it's hard, or there's been difficulty with if someone moves, having the counties work together on that process. So thank you for sharing those comments. Oh, and just to be clear, in case I didn't say it clearly enough, if someone is interested in revising their budget, or I'm sorry, let me restate that. If someone is interested in changing their plan mid-year, the consultation service provider is not going to notify you before they revise the service delivery plan. Okay, so the notification that they're providing to you is the plan revision. Okay, so they're not going to first call or email and say, hey, the person wants to add, add a blender to their plan. Should we do that? And then wait for you to say yes and then revise the plan. Instead, what they're going to do is they're going to take the current service delivery plan. They're going to add a blender. They're going to remove some dollars or units from the personal care line, and then they're going to submit it to you for approval. And then it's your role as a lead agency to determine if that change that they're requesting to the plan can be approved or not approved. And then you take whatever your next steps are. So if it's approved, then depending on the change, you might need to revise, you might need to send them the W, you might need to revise the service agreement. Okay, and then the provider might have to take some action. If it's not approved, then you take your next steps. What do you need to do to notify the person that it's not approved? Maybe it's that the consultation provider will work with the person and they choose a new good or a new service or something else, or maybe it's just denied. Okay, and then they continue with the current plan that they have in place.
So Erin, there's a comment about having trouble finding CFSS. So yeah, so I think really, can you scroll up and the home page is really where you start out.
Yeah. So this is the first page of our CFFS policy manual. So I'll just review it with everybody here, and Janine or Meredith or anyone else, feel free to jump in. But this is the home page to the CFFS policy manual. And if you go over to the left-hand side of the screen, this is the table of contents here, okay? So you can open up all of these little arrows. So if you're looking at covered personal care services, underneath there's health-related procedures and tasks, etc. Okay, so I'll go through another. So consultation.
Erin?
Yep.
Can I interrupt you?
Yeah.
I'm sorry, and I'm looking at multiple things here, but if you are going through this not as a saved link, as one of your favorites for the policy manual, what you can do if you go through the CBSM, you'll see the PCA page basically as it existed from the home page. And if you click on the link for the PCA manual, then that will redirect you. You click on another link to the CFFS manual. So I'm not sure if that was the question, but
okay.
For somebody who's going to the CBSM and looking for it, that could look a little different perhaps.
Thank you. Thanks for explaining that, Meredith. Okay, so
I don't know that that was the question or the intent.
That's okay.
Yeah, if they click on PCA manual, it'll provide you, it'll ask you to go to the CFFS manual. So I don't know if that helps, but I hope so.
Yeah. Okay. Thanks, everybody. Thank you. So that helps for you guys to know how to get to what I'm showing you here, which is the CFFS policy manual. So again, table of contents are here on the left-hand side of the screen. There's a whole bunch of different arrows that open up. So if you have a question about consultation services or you want to learn more information about consultation, we're going to click on this arrow. Okay. So we have a main consultation services page. I'm going to click on it. And I apologize, it's moving a little slower than I would like. But when it changes, it'll show informational consultation services, or if I wanted to know, here we go. This gives an overview of the services that they provide, okay? Or if I wanted to know what the requirements are for consultation services, and of course I'd click it on the link below, okay? Personal care workers has a lot. So personal care workers will have its own page, and then each of these different topics have their own page. So time and activity documentation, the training and supervision for personal care workers, information regarding paid parents of minors and spouses. Okay, so I'll just click on that one as an example, right? So that's really how you navigate the web page. And if you're looking for specific forms or resources, go down to this very bottom. And we have all of our forms in one spot. So if you click on the forms, well, there we go. Then all of the forms are located on this one page with a link to each of the different forms that are available for CFFS. And then we have just lots of different resources and other information sheets, such as that change grid that we were just reviewing together. So hopefully that helps know where some of the information is kept.
Erin, can I just show the CBSM front page and where you
Yeah,
go from there for a second?
Mm-hmm.
All right. Here, I think this is right. Okay, so this is the homepage for the CBSM in case you're more used to going there. And if you go down to home care, you will see a link to PCA. This is what Meredith was describing. And so you go here to the PCA page, and here's a link to the CFFS policy manual here, as well as some down here. But this will get you to the page that Erin was showing. That's the front page for our CFFS policy manual.
Thank you.
Yep.
Thank you. Can I just say one more thing too, please?
Yep.
Sorry. We're just going to keep popping on here.
Go ahead.
I have referenced, I know that there was at one point, a link from our manual to entry for Type B service agreements, but I just want to go back and say to Tina, I think I saw your question. I don't know that we get as specific about authorization for FMS and what that looks like between state plan and extended. And so that might be something that we would have to go back and potentially add some more information. Janine, I don't know if there's anything else we want to say on that, but I just kind of wanted to go back and let you know that I see your question, that I had said it would be in the manual page, and I don't know that we get that specific.
I agree. This is Janine. I agree. I think we need to find out from waivers, which is not us, about how that would look on a service agreement, how they would expect it to look.
Okay, I think I'm back sharing again, correct?
Yes.
Okay, sounds good. So to kind of continue on with that mid-year changes, that the grid I just reviewed, we did get one specific question that I just created a slide to talk through. And again, it's a little trickier than what's on the change grid. So the question was, what's the process for someone changing from a budget model to the agency model mid-year? So I'm gonna show you that grid again. Just a minute, let me pull it up. Okay. So changing models. So in this example, the question was changing from agency model to budget model, but it could be either way, budget to agency model. So a service delivery plan needs to occur. The county needs to approve that change. They need to complete the 6893W and send a copy to the person. They need to revise the service agreement. And if they're unable to revise the service agreement, submit the 6893I to DHS. And then the provider agency and the FMS provider need to work together to participate in a coordinated transfer of care. Okay, so that is what's listed on our grid. But the piece that makes just this particular revision a little more complicated than the others is that the consultation service provider needs to revise the service delivery plan. But really what they're doing, and this is where more of the complication comes in, the service delivery plan doesn't allow for somebody to have two models within the same plan. Okay, so what consultation providers will need to do, and what you'll need to be aware of when you're approving these plans, is they're going to have to end the budget model plan, calculating the total estimated dollars used. So they're going to have to ask the FMS provider or take an educated guess on how many dollars have been used through the budget model. And they're going to essentially have to like close out that service delivery plan, listing the total dollars used through the budget model. And then they're going to need to create a new plan, but this plan won't be for the full 12 months. This will just be a plan for the remaining days or the remaining months that the person is going to use the agency model. And then they're going to estimate those number of units that would be available under the agency model. So there'll really be two plans that are going to be submitted to you. So in this example of somebody switching from budget to agency, they're going to end the budget model plan for however many months the person used the budget model and estimate those dollars used. And then they're going to create an agency model plan with the remaining months and the remaining estimated units available. Okay, so the lead agency is going to get both of those plans. They're going to review the plans and complete the 6893W and send it to the person. Again, the provider agency and FMS are going to have to work on a coordinated transfer of care. The lead agency is then going to have to revise the service agreement. So they're going to have to end the FMS line. They're going to have to add an agency model line for all the different services. So, end the budget model lines and add an agency model line for all the different services. And then it's important to know that the lead agency may need to readjust the service agreement lines again after this process takes place, because consultation is really using an estimated dollar amount because the providers may not know exactly what those workers worked until a later date, right? So if somebody wants to change to a new change models, like at the end of a calendar quarter, right? So here, let's say at the end of September, the FMS provider may not know how many hours the workers have worked until those timesheets or the EVV system is submitted and paid, and those dollars are billed. Then they can give a final dollar amount of this is how much money they used through us as an FMS provider. And so you might have to adjust the service agreement at a later date, saying, finalizing what lines should be on the budget model lines and then what lines are available then for the agency model. Okay, so I'm going to pause there for just a second and see if there's anything in the chat regarding that specific scenario, since it's the one that's just a little more complicated.
So Erin, there's a question about two addendums for both plans when they change from budget to agency mid-year. And I don't know that, I wonder, is the question, would you complete one ending of an addendum ending the one model and a new addendum for the new model? I feel like it would just be the new addendum for the new model, if that's what the question is, right?
I think, yeah, I believe so. Yep.
So there's a question about calculating some stuff. So you can use our calculators to figure out date-wise, like how many on average would be the correct amount. But it is a little bit like when people change agencies right now, understanding how much that agency has billed or will bill in the near future and dividing it out that way. So whatever, when we're looking at a year span, it's basically understanding how much was spent in part of the year in the one model, and then using using the information from the providers about how much they're going to use to look at how much is left.
There's a question, and I guess I don't know the answer to this one, Janine. When someone's changing from agency to budget, or even if someone is just switching CFSS provider agencies mid-year, who's responsible to notify the current agency of the change? I guess so they stop sending workers out to work.
Well, usually it's the person, but it might end up being someone else, not consultation, but it could be the lead agency when you're putting in a new line. But somebody has to let them know. And most of the time it's the person saying, I'm going to change agencies, and really working it out with that provider about when they're done and when they're going to the new agency. But if all else fails, it is going to have to be the lead agency that says they chose a new provider agency and you're changing the service agreement.
Just so everyone knows, we are seeing, if you're somebody who's just writing a comment to us versus a question, we are seeing your comments, just so you know. I might not be reading all of the comments out loud, but we do see them come through. So thank you. For mid-year changes, do lead agencies still have 30 days to review and approve the change? I believe so, correct, Janine? And it might happen sooner than that, but. Okay, I'm not seeing any new questions regarding this particular slide. So I'll go ahead and move forward. And this is, looks like we have about 13 minutes left. So we'll just open this up to any questions you might have, whether it's the topic that we reviewed today or any other questions that you have for us. And I'll just pause and give you guys a minute to put some questions into the chat if you have any. Okay, so the question came in again as if there's a timeline on when you can expect to hear more about what DHS is working on to avoid a gap in service. So no, I don't have an exact date of when we'll make an announcement, but know that we are aware of the issue, conversations we're having here, and we will tell you as soon as we have more information. We know that everyone is waiting. We'll let everyone know as soon as we can. So there's a question regarding the consultation services on the LTSS rate sheet about the code for consultation services. I'm going to pull it up unless Janine or Meredith, if you know off the top of your head, I believe that is you're only entering T1023 and consultation is using the modifier when they bill, right? Or when
You are correct. Yep, you're correct.
Yeah, so you don't need to add that modifier of TS. They're indicating within their claims what they're doing with the person, and they're adding the appropriate modifiers if needed. So you're just entering T1023. Oh, okay. Sorry, I did miss this question before, so thank you for putting it back into the chat. So somebody's asking that they've been looking at the CFFS information, FAQs, etc., and wondering if there's any language that specifically states lead agencies are to prorate CFFS based on approval dates. They haven't been able to find anything specific, and they have an appeal. Yes, so if you give me 1 second, I'll find that information. If someone else puts a question in the chat, maybe Janine and Meredith, if you could answer it while I'm pulling up our policy manual.
Sure.
And then I'll share my screen once I have it pulled up. Okay, so in the policy manual, there is a page under the service delivery plan section here. There is a page for plan approval. And if we scroll down here, lead agency authorizes services using a start date based on the person's situation. And it's a second bullet. The start date is the date the lead agency approved the CFFS service delivery plan. That is also on the actual service delivery plan itself. I believe in a couple of different sections. Let me see if I can find it on the plan too for you. At least it used to be there. Let me I'll scroll on a different page so I don't make everybody sick. Janine and Meredith, if you want to answer some of the other questions in the chat while I'm working on this, you certainly can.
Okay. There's a question about a service agreement with a no pay code. And I guess I need to know from lead agencies who look at their InfoPack report on the 60 days service agreement expiring, if you see ones that have a no pay code in. I don't think so, but I am not certain because I don't have any access to those reports.
Okay, I'm not quickly finding the information directly on the service delivery plan itself. But as I showed you before, that information about that it's based on the date of the plan approval is located within our policy manual.
So there's a question in chat about the addendum is only required if dates or units are not accurate. And today we're stating that it's required for any changes mid-year to the service delivery plan. So the addendum was created because there was a lot of discussion about who could change the service delivery plan. And originally it needed to keep going back to the person for signature and took longer and longer, back and forth and back and forth. So we created the addendum, which is the W, to allow lead agencies to put the final tally of like what's actually being authorized in there. And then that together with the service delivery plan gets sent out by the lead agency. So people understand when they get their copy of their service agreement that the dates and the units on the service delivery plan are arbitrary based on when the authorization actually is made and the date, start date, and all of those kinds of things. So when reassessments are done and a plan is developed, there is a W that goes with every single plan to just reiterate that this is what's being authorized by the lead agency. So if there are changes that happen mid-year to the service delivery plan, in our grid, we would have what needs to change and who needs to do the pieces of changing. Really two different situations, like the plan that's built because of an assessment or reassessment and any changes that happen during the year.
Okay, thanks, Janine. I want to acknowledge that the person who asked the question regarding the policy page that I was referring to made an additional comment, and I'm understanding what you're saying now. So that while we have here that the start date of the plan is the date that the lead agency approved the plan, that it doesn't specifically say that those units are prorated based on the service delivery plan start date. And so okay, let us bring that back, because you're right that it doesn't say that, but although it's a units per day that are being used to calculate the total units or total dollars available for the person.
Correct. Correct.
So that, yeah, okay. Okay.
Yeah, it's historically actually been true for PCA forever. So when a provider was chosen in PCA land and it was 3 months after the assessment, that line item started 3 months into that year span, and you did not, there was no in quotes banking of hours. You didn't get all the hours back to the assessment date. You got the hours starting when the provider was starting.
Janine, do you see the question? I'll read it out loud. It says, question regarding individuals transitioning to the waiver from CFFS with goods and services. Typically, lead agencies route the existing Type B SA to DHS to end, but in doing so, for an individual receiving state plan, CFFS with goods and services, DHS sent back a request saying that it needs to be reported on the 6893I. So who's responsible for completing the I? So that would be you at the lead agency is submitting the 6893I. And then it says it also appears as a lead agency, we're able to adjust the end dates and amounts on, I think you probably meant to write on the Type B service agreement. So yep, lead agencies are now able to make revisions to the service agreement for up to 183 days. So that is a change you could make with that.
So Erin, there's a couple of things about the start date being difficult to anticipate, et cetera. And that is true. So I think early in the year, we were talking about, please don't put a start date in before we know when the provider can actually start. So, you know, for CFFS agency model, those providers have a lot of things that have to happen up front that didn't happen with PCA. And so I know we were hearing that provider agencies were nervous because they would get, at the end of February, they would get a service agreement saying this person is CFFS at the beginning of February, and there was no way that they could actually make that happen. So they would likely go without payment for that whole month until they could get all their stuff done that they need to do before they start serving the person. So I know we've had conversations about really checking in with the provider. And so if the provider says we can do it on this date, that's the date that would be most appropriate to use. And so we're approving plans today with the start date of like 9/22 because that's the preference of the provider, and noting that on the W. That's fine. That's fine, because we don't want either FMSs or agency providers to not have a chance to do all the things they need to do up front before they can actually start providing service to people. So that is, it wasn't really true in PCA. There was stuff that you could do in the first few days, in the first couple of weeks, instead of ahead of time. But for both agency model and budget model and CFFS, there are things that those providers have to do ahead of time before they can actually start providing services.
Thanks, Janine. And I recognize that we're just a couple minutes over 11:30. So I think we'll end our presentation here. I just have one more slide I wanted to make sure you guys saw. We did schedule out the office hours for the rest of the year, and they are going to go back to a 1-hour meeting. Those will be on October 16th, November 20th, and December 18th. I have a link here. This presentation is going to be posted on the DSD Training Archives page, and I can send this link out as well to the attendees today. But you can register for those office hours by using this link. And then just the last couple of slides are the same as we've had at most of our presentations, just available resources and trainings. So thank you everybody for attending today. We appreciate your time and your good questions, and we'll see you again back here in October. Have a good day.